mtu akiwa ameanza kutokwa na damu kwenye mapua, the first thing you need to do is to look for a clean cotton, a clean handkerchief, all sorts of that, a clean cloth, piece of cloth, apply kwa mapua to stop the spilling off of the blood. Number 2, tafuta maji baridi. Dip the piece of cloth inside, then apply on the forehead. Just apply the cold water piece of cloth on the forehead. If you can, try to sprinkle cold water from the back of the head. Then make the person comfortable, either seated on, lying down on the left lateral position. Common mistake people do at home, they apply the pressure on the nostrils, then they just face up. That's wrong. If you apply pressure on the nostrils, then make sure the head is tilted forward to avoid blood spilling, the bleeding of the blood that is coming out, going into the inner parts of the head. In all this, he or she might stop the bleeding, but bleeding, if it persists, take the person to the hospital, because at times nose bleeding itself is a condition, or rather it's a disease, so it has to be managed in an hospital setting. But if it is merely caused by upper respiratory tract infections, the sinusitis, it stops with cold packs. The applying of the piece of cloth in deep kwa maji baridi on the forehead and on the back of the head. That helps. Basically, it will help in reducing the dilatation of the vessels ambazo zimerupture kwa mapua, causing the bleeding. Because in nose bleeding, it's basically the inflammation of the blood vessels supplying the nose region, the inner part of the nose. They get burst and they bleed. So once the pressure is applied on these blood vessels, bleeding stops.